Dr. Adam Aponte, CEO for the East Harlem Council for Human Services. I am a New Yorker, born and raised in East Harlem actually, and has been a physician for almost 30 years, despite my youthful appearance. I've been doing this for quite some time and have this lifelong dedication to serving my community and wanted to serve in this capacity as a physician. And I've been doing that for quite some time, now serving here in East Harlem as the CEO of this wonderful organization. Really be proud to be leading this effort. My focus has been around serving underserved communities, ensuring that they have access to high quality healthcare, as well as trying to increase the diversity of the healthcare workforce. That's something that has been really important to me as well. You know, as a little kid, when I had this daring dream to become a physician, there were no doctors in my community that I could look to. And I wanted to serve as a role model to others to show them that you too can become that despite where you come from. So that's the work that I've been doing over the last 30 years. So I joined the organization in July of 2020 as the Chief Medical Officer originally, just at the beginning of the pandemic, and really reached out to the previous CEO to offer him and lend my services. And I did that intentionally because, you know, East Harlem is my home, as I mentioned. This is my community. And I know that many organizations were struggling with handling this pandemic. And I imagine a federally qualified health center like this would be challenged as well. So I wanted to lend my assistance, which I did, and I joined the organization. And over the last several years, worked through here, got to know the organization very well. And upon the retirement and departure of our former CEO, I was chosen by the board to serve as the CEO, which of course I was very privileged and proud to take on that position. And why East Harlem? Because this is my hood. This is where I represent. This is my community, and I want to make a difference in this community. Yeah, so the East Harlem Council for Human Services is almost 60, as a matter of fact, this year we hit our 60th anniversary. It was created in April 22nd, 1965 by a group of individuals in East Harlem who wanted to improve the living conditions of the East Harlem community in the mid-60s. And interestingly enough, some of the issues that they were concerned about, housing, healthcare, are some of the same issues we deal with today. So the council stands here today and runs several programs, one of which is a bilingual Head Start program, one of the very first bilingual Head Start programs in New York City. And then shortly thereafter, we developed the Boriken Neighborhood Health Center, a federally qualified health center that offers primary and preventive care services to anyone who walks through our door, regardless of their ability to pay, regardless of immigration status. We also offer school-based health programs. And then we have a senior nutrition program for older adults. So as you can see, we run the whole spectrum of life as far as the services that this organization provides to our community. So some of the biggest healthcare challenges in this community today, and how this council has responded to them, I think the data is out there. When you look at East Harlem, unfortunately, it has a disproportionate of health disparities. When you think about cardiovascular disease, pediatric asthma, diabetes, hypertension, all those sorts of conditions disproportionately impact a community like East Harlem. And so what the council and the Boriken Neighborhood Health Center particularly aim to do is to provide easy access to any patient who needs it, a one-stop shop. We do a lot of things in this one building. We offer services, what I like to describe, from womb to tomb, prenatal care all the way through the life spectrum, behavioral health services, care management. And what we try to do is make sure people get that primary care, which we know is vitally important, and then help them navigate this very complicated healthcare system of ours. Many patients are challenged when they're trying to seek healthcare. They don't know how to navigate it. Even for those of us who are well educated, we face these challenges when we have to sort of go to all these different doctors and these institutions for specialty care. And so what the council does and the Boriken Neighborhood Health Center does is help patients. We literally hold their hand and make sure that they get the service that they deserve. And I say deserve because everyone has the right to great quality health care. And so that's what we've been working to do for the patients that we serve in this community. Yeah, so we have a lot going on since I've become the CEO, and I have this incredible sort of energy and vision for the things that we should be doing. So first, at our health center, we're going to be adding on some additional services. We're expanding our dental services. Oral health is really, really important. People often neglect their oral health services. We're expanding behavioral health services. We saw post-pandemic how many people now are seeking behavioral health, mental health services. And then we're also offering physical therapy, occupational therapy. And as I mentioned earlier, this is a milestone year for us. The council is now 60 years old. Incredible to be in this community for 60 years. And in a celebration and recognition of this 60th anniversary, we're going to host our very first gala that will be held on April 22nd, 2025, an exciting event where we'll not only be a gala to raise some funds because, as a non-for-profit, we're always trying to raise some funds for our programming. We operate on very tight margins, but it's also a fundraiser and also a chance for us to tell our story. I think the fact that the council has been around for 60 years, there's still many people that don't know all the work that we do that I described earlier, right? All the different programs, all the lives that we touch. And so we welcome folks to join us in this celebration of who we are, where we are, the vision we have, and what do we need to do for the next 60 years if we really want to impact the healthcare system. We've made some inroads, but there's a lot more to do. And we're going to it's going to be a call to action for our partners as far as how we need to do things differently. We need to work more collaboratively. We need to break down these silos. We need to really embrace patients and be truly patient-centered. And so that's what we'll be sharing at this really exciting evening that we'll be having shortly, 40 days away, as a matter of fact. So we welcome the support of all individuals to support the work of the council. Clearly, one very tangible way to support us is by attending our gala. And you can get more information about our gala by visiting our website at www.boriken, that's BORIKEN.org/gala. You'll find information about the gala and how you can participate and sponsor. We have obviously donations, but we also look for people to help us volunteer or perhaps identify resources for us that we can capitalize upon. So there are many ways that folks can work with us to help us deliver on the mission that we have to improve the life of the individuals that we serve in this community and our surrounding community. So we recently became members of the Washington Chamber of Commerce, Washington Heights Chamber of Commerce, and we're really happy to join that collaborative. And the benefit that I see from that organization is more collaborations, getting to more people. I've met some incredibly resourced individuals who really know the landscape of what's going on here in New York. Currently our health center is considering building a new health center in Washington Heights. And the individuals that I've talked to at the chamber there in the Heights have been extremely helpful in helping us to understand the landscape, the need, who are the players, resources, opportunities, individuals. So really exciting to be a part of that chamber and being part of that network of individuals who are leaning in to improve their community.